Hi, morning. Well, hi, my name is Padmore. I'm founder of Friends for Life, and we do work with gay men or MSM and sex workers to give our work, what we in Friends for Life have done as it relates to work with sex workers, and that's the reason for me being here. I see it as an opportunity to improve on this service, and I say improve on this service simply because for all of us, we're yet to figure out or to know what or how to effectively reach sex workers.
I'm trying to get a little more information on sex workers.
My name is John Hassel, and I work for the Caribbean Regional Support Team for UNAIDS, and we help facilitate all the UN system around the AIDS response in the Caribbean.
I was hired by FPAC to do an evaluation of the sex work integrated health project for the period 2007 to 2010. So basically I'm going to present the findings of the project, look at some of the successes, some of the weaknesses, some of the gaps, and see how as a community of partners we can work together to move forward to address some of those gaps.
I'm here representing the Caribbean Sex Work Coalition and the Guyana Sex Work Coalition, making certain that sex worker voice is heard in every meeting that there is.
Good morning. I'm Ingrid Neckles, coordinator of the HIV/AIDS coordinating unit. My purpose for being here today is to attend the to attend the workshop with regards to the research that has been done in the areas of MARPs. I am representing the HIV/AIDS coordinating unit under the Ministry of Health.
Today is a very important day for us because we are all coming together as stakeholders involved with working with vulnerable populations, particularly sex workers, to discuss the work that we have been doing, to look at some of the findings, the conclusions, some of the recommendations that have come out of our projects to date, and also that we can work together to chart a way forward. Sustainability is an issue for us, and therefore this is going to be a very important dialogue today for us to discuss how are we going to continue to do this very important work to provide sexual and reproductive health services to sex workers, to do advocacy, what are the challenges that we still face, and we are looking at this against the background of the legal and the legislative and policy framework of what's happening in the Caribbean. So we are very happy today that we will be able to meet with all our colleagues involved in this, in working with sex workers, so that we can make some very concrete plans on the way forward.
Red Initiatives. I was invited by Family Planning Association of Trinidad and Tobago to be here today to look at the way forward with regards to sex worker projects, not only in Trinidad and Tobago but in the Caribbean. And I think it should be looked at on a regional level because, you know, these populations are mobile. We are so close to each other, and I think it's only as a collective we can really look at the issues of sex work and all the other social issues that surround it, regards to policy, legislation, human trafficking, gender-based issues. You know, I think if we would go towards reform together, I think, you know, it could really make a difference instead of maybe doing it in isolation.
My name is Tracy Rogers. I'm the study lead at the Ministry of Health with NASTAD, and we are here doing some biobehavioral surveys among vulnerable populations.
Today we are partnering with our international parent body, the International Planned Parenthood Federation, to ensure that this kind of discussion will take place successfully. We also have some very important stakeholders that will be joining us here today from the region. They are the Caribbean Vulnerable Communities and COIN from Santo Domingo. We also have all our local key stakeholders, Population Services International. We have as well with us today Red Initiatives, Friends for Life, and all the Ministry of Health, a very important body that is really doing some groundbreaking work in terms of gathering evidence for further action. So we all will be participating today, dialoguing together and coming up with some plans, some very concrete plans on the way forward as we continue to do this very important work with sex workers in the region.
Good morning. Colette Browning from the National Council on Drug Abuse Jamaica. I'm here to make a presentation today on the work that the agency is doing with the Executive Project on Homeless Sex Workers. I'm here to share what we've found in Jamaica with them here today.
My name is Moira Denman. I'm the Regional Program Manager at PSI Caribbean, which is Population Services International. And we work across the Caribbean region, but we have had the pleasure to work with FPAD here in Trinidad and Tobago. Our main focus in our collaboration with FPAD is to reach out to the commercial sex workers.
It makes sense for others to learn from other persons' best practices and mistakes as well, so it's best to share the information. What we realize as well is that what happens in Jamaica happens everywhere in the Caribbean. So if it works for you, then it should work for me. So sharing information is absolutely necessary and important for that purpose.
Yeah, I'm here basically to facilitate the needs and to give encouragement and empowerment to sex workers. Because after being involved in the activities for so long and being attached to family planning and giving the information as to what is going on, what is happening, educate and empower our people in this small community that does involve sex work. FPAD have been giving a lot of contribution towards education, empowerment, proper use of condoms, information as to our medical issues as to what is required, what checkup and what is needed for women, not basically for the women really, but the male sex workers and also the transgender.
And it is indeed my pleasure this morning to welcome all of you here to this dialogue where we will be talking about the Caribbean Sex Work Projects, strengthening evidence for sustainable action. I'm very, very pleased to be here with you, all our partners, to collaborate in this event. As you know, a number of us have been doing very interesting work in the area of sex work, working with sex workers, either in services, advocacy, or even helping them to build coalitions. And we, as part of our own project, our Sexual Health Integrated Project, had a mandate in order to disseminate the findings from our own project. We thought that it would be useful to do so not only with our local counterparts, but also to include some of our key partners in the Caribbean sub-region so that we'll have a more enriching dialogue. So here we are today, gathered here, all in the same room, all with the same aim and objective, to share with one another the findings, the conclusions, and make some recommendations with regard to the work that we have been doing with sex workers.
And I'm from Guyana, and I'm here representing two organizations, the Guyana Sex Work Coalition and the Caribbean Sex Work Coalition. And we advocate for sex worker rights, and today I'm here to represent sex workers and be their voice.
Good morning, I'm Ken Subno from Guyana, accompanying Miriam Edwards, representing Guyana Sex Worker Coalition. Thank you.
Good morning, everybody. I'm Moira Denman, representing Population Services International, also called PSI, and you'll hear more from
I'm Aurora Noguera Ramkisoon. I'm here actually on behalf of the Family Planning Association in Trinidad and Tobago. I am a consultant. I'm conducting an evaluation of the project on sexual health integration. Many of you may have known me before from the Pine Capital and Groups project, so it's very nice to see you all again.
Good morning. I'm Randy, and I'm from FPAD, and I'm here as an advocate and as a person that used to practice sex work, and I'm also here in connections with as a peer educator, and I'm trying to still be here, encouraging my peers actually about awareness, which seems to be one of my biggest issues.
Good morning, everyone. My name is Anthony. I'm a field worker, and I also do work with Friends for Life.
Eswick Padmore, Friends for Life, field worker, founder, everything.
Good morning, Tracy Rogers, study coordinator, study lead for the Ministry of Health Surveillance, Biobehavioral Surveillance Studies.
Luke Sinek, President of Friends for Life, and Eswick is everything.
Good morning, I'm Marissa Thomas, Project Coordinator for COEEN CBC. I work here in Trinidad. As Mrs. Martinez said, I wear several hats, but today I'm representing COEEN CBC, and we do work with vulnerable populations, including sex workers.
Good morning, I'm David Samari, Coordinated Programs and Services, Community Action Resource, CARE. I'm just here to lend support.
Good morning, I am Gloria Ann Barker, County Health Visitor Population Program Unit, Ministry of Health. We deal with sexual and reproductive health, so that is why I'm here.
Good morning, Lois Herrera, Population Program Unit. I'm the Principal Statistical Officer. And because of my work, I'm very interested in sex workers because we do provide contraceptives to these persons, and I'm the one collecting the data. And it's important to me to know a little more about the data.
Good morning, Ingrid Nichols, Coordinator, HIV/AIDS Coordinating Unit.
Good morning, Colette Brownie from the National Council on Drug Abuse Jamaica, Project Manager for Take It to Them, or Take It to Them, a homeless street project that targets persons living on the streets in Kingston and St. Andrew. Among that population are sex workers. Thank you.
Hi, my name is John Hassel. I work for UNAIDS Caribbean Regional Support Team, and my title is Senior Advisor for Regional Partnerships, and I'm here because I love sex workers.
Now, given this long-standing organization that has been around for so long, FPAD has continued in advocating for sexual and reproductive health rights and has been strategically involved in the national response to HIV and other sexual and reproductive health issues nationally. It served as the chair of the HIV Prevention Subcommittee of the formal National AIDS Coordinating Committee. And it also has been a member, and still is, of the Sexual and Reproductive Health Working Group, which was established by the Ministry of Health's Population Unit. And it is a major key service provider and advocate for the sexual health rights of persons in Trinidad and Tobago, and the integration of both HIV with sexual and reproductive health, which has been separated for a while now.
The demographics of the clients stand up to senior citizens coming together, migrant populations and other establishments. So it was an eye-opener for us that there's so much other areas we need to look at. And again, this population really held a lot that you don't see any naked eye on the streets and all that. They were kind of hidden from the everyday person. An opportunity again for us, we were able to network with a number of fellow CSOs with regards to the actual facilitation of the groups. We had Aspire and Rape Crisis. They did lectures, they came in, So it was an opportunity to work together. and of course the promotion of HIV.
This is PSI, Population Services International. We are an international organization. The headquarters is in Washington, D.C. in the States, and we work across the whole world. PSI is most well known in Africa. That is where their largest programs are. Worldwide, they do other programs such as tuberculosis programs, malaria, clean water, but in the Caribbean, the focus is on sexual reproductive health, basically, in a nutshell. These are the countries we work in the Caribbean. It's not actually Guyana at the bottom right, it is Suriname, but they didn't fit on me on the picture. And Belize to your far left, and then everything in between. So basically we have our head office here in Trinidad, and then we have, not really offices, but we have one person in Jamaica, one person in Suriname as well. So we have a little support in those two countries.
We offer a non-judgmental service of friendship. And for us in Friends for Life, that is very important, because MSM, sex workers, whoever they be, they are at some point in time judged on what they do. HIV and AIDS, STI prevention, information and education, counseling, and professionals referrals. And when we talk about all referrals, be it clinic, accessing whatever services, wherever it is. Residential and institutional care and support. We have a relationship, for example, with St. Vincent de Paul. And so, at one point...
I have a number, but it will be more than 5 minutes, but I will piggyback with Estwick's presentation, which I found to be very, very informative, very useful, and it has actually given a lot of indicators for us at the Ministry of Health. Now, as you were presenting and you're talking about the facilities available or lack thereof for the commercial sex workers, etc., it took me to Amsterdam, where they have a program where they actually do go out at night, where the commercial sex workers, be it male or female, are tested, and they also have a supply of condoms, and they also have a medical board in the event that they may need medical attention. And seeing that you have such access and you know where these sites are, even with regards to the brothel, I am thinking, gone are the days where we have to really expect our client population to come to us. And it's about time we start thinking about taking the service out to them. And in that line, it kind of have me somewhat interested, I should say excited really, but interested, whereby we can work with, we meaning the Ministry of Health, can actually work alongside the NGOs, such as Family Planning, Friends for Life, etc., actually working to bring this service out. Even if it means that the health workers have got to work shift instead of working daytime, they work evening shift, that sort of thing. One. Two, with regards to SRH, while we do have a SRH program, it is a general program, so it's for any and everybody. And as I was speaking to my two colleagues here, and I'm saying that there is clear indication for us to actually have a service particularly targeted at commercial sex workers. One, in very much the same way as we are working on projects with regards to men's health.
Mapping with sex workers in Guyana, having me there as the co-chair, I think that was one of the things that made them come to Guyana at that time and did a mapping, and we had sex workers from 7 regions of Guyana present. We have 10 regions, but the funding that we had could have only brought persons from 7 regions, and it brought together 21 sex workers. And by the end of that meeting, we was able to form the Guyana Sex Work Coalition.
In Antigua, and both entities are, at the bottom of this slide, kicking ass kicking ass in their country, ensuring that nobody in country abuses sex workers, ensuring that nobody gets away without them making up, I don't want to say making noise because that is really devaluing what they do, but strategically advocating for the rights of sex workers. Now they no longer need the kind of holding hand that needed to take place in their own. They have their own internal organizing mechanism, and they have gone out on their own and secured additional funding. And some of that funding is not just international funding, it's raising their own money internally, in country, and managing that money on their own. It is possible. In the second year, we expanded to again include Antigua and Guyana, and this time we included Curacao and Grenada. Now, the peculiarity about the Grenada case, let me honing on that, is that one of the things that was said is that there are no sex workers in Grenada. Well, we said, oh yeah? Right. You hear that all the time, and I'm putting it on the table, it's not a joke. It is one of the things that's said to deflect from serving vulnerable populations. Well, Miriam went down there, and within a couple of hours, she was able to gather numerous sex workers together. All right? And not only did she gather them together, she did the formative research, she did the preliminary work with them, and was able to help with the formation of a group in Antigua. Now, in Grenada, in Grenada and also in Curacao, this work was done through an already, both were done, pieces of work were done through an already existing organization. And both these organizations had sex workers, had been doing work traditionally with MSM, but had sex workers coming and saying, what are you going to be doing for us? So both these organizations, and please listen to this carefully, were challenged by sex workers to take on sex work as a part of their mandate. Miriam went, did the work in Grenada, and that work started up. And so we want to flag the idea of peers, of regional peers, being able to get some of that work done in country. We don't have to fly somebody in from some other place in the world to get it done. You have people in the region who can do it. All right?
What happened is we discovered that when a testing was done in a particular area in Kingston, and when the results showed that 82% of the persons at that time, which is 9 out of 11, were HIV positive. They were all substance users.
And that we need to do more testing. So I just want you to speak to that a little bit. And Brownie, I was just kind of curious in respect to the percentage of young people versus adults that you're seeing on the streets. And I see you listed ganja, crack, ecstasy. Do you find the abuse is mainly with the ecstasy and the crack, or do you put ganja and alcohol on the same level?
And this presentation could basically be summed up in saying that it is illegal, grossly illegal, and very unfair. But the legal environment in which sex workers operate in the region, we know very well, right? In most instances, it is criminalized. We have to say that when people point to Holland and say, oh, there's an example, the difference in our region is that we have examples where it is not criminalized in our region. So, Curacao, for example,
and certainly the Ministry of Health would like to be a partner, at least the Ministry of Health Trinidad and Tobago. However, remember that the Ministry of Health, we deal with the entire nation at large, which is with respect to the health status of the entire population. We know there are many different groups and stakeholders even in the context of HIV. And our business is really one of policy setting, standards, regulation, programming initiatives.
It was David, actually. David and I had a little go-between on Facebook the other day. He wrote a wonderful essay about vulnerability. And basically the thing that came out of it was not all vulnerability is the same. There are a number of vulnerable communities, a number of vulnerabilities, but a young person in the countryside has a different set of vulnerabilities than somebody who's in the urban city. And so what we see is that a number of different types of sex workers all have different vulnerabilities based on where they are, what they do. So we just, give you an idea that when you come up with a framework for sex work interventions, this generalized thing of sex work is not necessarily you have to be more targeted. And this is one of the basic premises of harm reduction. Targeted interventions to people who are engaged in specific behaviors. And so, you have to be very careful giving the wrong message to the wrong type of sex worker. A sex worker who works on the street is much different than somebody who works in a brothel, somebody who advertises. I think Dr. Amori actually talked about that in terms of people who have private, out-call people rather than in-call these.
Exactly, when they go into places and talk, but as far as the HIV data, that's not a problem. Because it's in a book and we have access. We could go to the book and see, okay.
You don't want to talk about it. So I heard a couple things already. I heard you said there's a problem with the data, there's a problem with the law, but what we've been asked to on here is say, okay, what are the actions that we need to take to address it?
We had an experience where it depends on the interest and who's funding and what they consider to be a priority. So all these things are factors that we need to take into consideration. That so unless it's HIV based and HIV in a particular context through a particular lens, but they're not willing to look at HIV through persons with disabilities or who are vulnerable, other vulnerable populations. They're not looking at it through that. No. Probably if it becomes an epidemic or it becomes a pandemic state, then they will say, hey, we need to get FDA, we need to get these people to come to do a survey. No research is being done. The money is not going there because it's not something, so that's the problem.
It's not important,
No. With the Caribbean sex work, we went to Grenada and we was able to form a group that is still existing. They never get funds after then and they're still there because we keep contact with them. Their group is the Woman of Worth.
The Woman of Worth.
Woman of Worth. They name their group. And because I keep in connection with them, a lot of times sex workers need the push from other persons to keep it going, because if I didn't have Ian and Robert and Marcus, who sometimes I know they used to get fed up with me with phone call all the time and so, right? They must get millions of emails from me. But because I had them, I was able to build on foot.
And because it doesn't make any sense if you have the opportunity to actually form a group and you do not partake in that group, participate in that group, and then you go and start complaining that the system is doing nothing for you, then what's the point? You understand? Because the system wouldn't listen to an individual, but they will respond to a group, 3 or more. You understand? And that is where the strength lies.
We first talked about the lousy data. And what do we need to do about the lousy data? 1988 is not current. I don't know about you, where you were in 1988, but I was not thinking about the UN. I just turned 30. A long time ago. So in the data collection, we need to know how many, we need to know all the aspects of the demographics, race, gender, income, am I missing anything? All those things that census takers think about. We need to know, and this is all in the context of sex workers, we need to know their location, their seroprevalence. We need to use focus groups to get the qualitative numbers.
Group 1 said we need to upgrade, John's group said we need to update our data. To have old data like that is not good enough. So that is group 1. Group 2 said, yes, we're agreeing with you, but don't sit down and wait until all of that data is collected, is analyzed, is disseminated. Don't wait on that to start action.
I know the way you Or when you bring sex workers together for meetings, a lot of times persons don't even bring sex workers together for meetings, and then they would just say, well, look, we had a sex worker consultation or we had a sex worker meeting, and that is it. When you left me, you go back to your country, nobody consults with you, nobody, nobody don't even contact you until maybe a year or so after, when maybe they want another meeting somewhere else, and they remember, well, oh, we got Miriam there, or we get this person here.
I think yesterday's meeting was a very successful event. I feel very fulfilled and satisfied that we were able to achieve the objectives of the one-day dialogue. I think it was very important for us to come together to share and to discuss with each other the projects that we have been doing in our various countries. I think we have learned a lot from each other, and we understand that while there are similarities across the region, that there are certain aspects of our work in country that are very unique to each island. And I think that in itself was an opportunity, provided us with the opportunity to discuss, to share information, to network, and I am very, very pleased about the outcome. I was particularly pleased with the participation of the various organizations that we invited. Some of us, sometimes we operate in our silos and are not quite aware of what is happening in the region, and also what are some of the challenges that are faced by some of the other civil society organizations like ourselves in terms of the work that they do. There's still quite a lot of work to be done, and I think we recognize that from our discussions yesterday, and that what we will be doing is at least forging a stronger network of organizations involved in sex work so that we can become more effective, that we will ensure that we reach out to the right groups, that we will ensure that we use the evidence that has come out from our various projects to really strengthen our work with sex workers particularly.
I think this was one of the best consultation after a very long time, where we as sex workers was able to be involved, sharing what we've done over the years by FPAT, and it is good when people could recognize the work of sex workers and trans people, to bring them together, to hear from them, and also to listen to them, to what they want for the future and what we've already done, and also to share with us what they're doing and what are their plans for sex workers.
I also want to thank UNAIDS for being present at the meeting with us yesterday. I think their contribution and their whole interest in sex work, and particularly most at-risk populations, signaled to us a commitment with their involvement with us yesterday. We want to thank as well UNECLAC for allowing us to use the facilities yesterday at very short notice.
And as we've always said, that we don't want anything to be planned for sex workers without sex workers or with trans people involved, because these are the population that people always making plans for. They always think, well, this is what sex workers want, or this is what trans people want. But being involved in the planning of everything, we feel good as sex workers, we feel good as trans people. And when these things happen, we start feeling like if our voice is being heard, and like if there is a place out there for us. So this consultation was really, really good, and I felt real happy with this consultation. I feel like if we were getting somewhere. So I must say thanks to FPAT for having us here and listening to us, listening to what we've done, and listening to what we want.
Miriam, we love you, and we really appreciate what you do, okay? Good.
You could have sex with them for a job, and they just see it as a transactional sex, because, I mean, they need to get to school, they don't want to drop out, but the parents can't afford. I've learned a lot from him with, you know, people out in the street. As a taxi driver. around Guyana. So
School girls alone, but
and
women on their own, you know.
and having people like them involved, but people don't see them as getting paid from women, but it happens.
Exactly.
You know, so it's good that you get these people involved.
From what developed yesterday?
Yesterday surprised me a bit, knowing that the Ministry of Health, the local organization that should take the lead in this initiative, don't have a clue. They don't have the statistics, they don't have the information. There seems to be little interest.
Yes.
So for me, that was a big thing.
Yes.
Because in Jamaica, it is the Ministry of Health
that takes the lead.
And they're so involved in it. So for me, that was a big thing.
Yeah.
And then to see Brandy there and saying, what about my rights?
Yeah.
Why should I go to a male restroom or go out to the hospital and go to the male ward? So I've never had those thoughts in my head. So at least now I'm thinking, what about the rights of everybody? We're all somebody and we have rights. So let's try and treat everybody with dignity and respect.
Yes.
So for me, that was what was highlighted yesterday.
Very good.